So my name is Kyle Kellum. I'm the Chief Executive Officer here at Jennie Melham Memorial Medical Center in Broken Bow, Nebraska. Previously was the Chief Operating Officer at a critical access hospital in Colorado, down in Pagosa Springs, Colorado. One of the things that in working with Jamie that when we decided to work with Jamie was we were having some challenges in our clinic, and there was some process flow efficiency challenges, getting enough patients through, which was a huge challenge, I think, like a lot of clinics are facing. And so bringing Jamie in to look at the clinic and put a efficiency set of eyes, the Lean Six Sigma set of eyes on things was a huge benefit for us. So when we brought Jamie in, we did the pre-measurements. Where are we? Where do we think we can go? Where do we want to go? And then saying, Jamie, what can you do for us? Where can you get us in that hybrid that I just talked about? And so at the beginning of the project, we had low numbers in the clinic per provider. We were around 12-ish patients a day. We bumped up to 16 and 18 patients. So it's a significant jump. And that was a huge jump for us, going to those number of patients in a small community that we didn't have. We don't have 15 family practice providers, and whether in Colorado or here. And so being efficient with the process and getting patients in the door in a timely manner, that door to doc time, all of that good stuff that really matters when it comes to patient experience to keep them coming back, were things that we were really focused on. So, when we look at the metrics, that's one piece of the puzzle, but also the final outcome of it as well is financial, right? So when we go from 12 patients in a day and move to 16 and 18 patients in a day, financially it puts us in just a better position. So we were really happy with that, taking the team and not necessarily needing to hire more folks. It was needing to make our processes more efficient. So very pleased with the results of the project, very pleased with the whole project from start to finish. Very involved. Jamie, of course, was very involved, guiding us, teaching us, so that when Jamie left, it wasn't just what do we do now, right? It was, well, let's continue the great work that's already been done. So that education was a big help in our teams and getting them to where we needed to go. So, in terms of if anybody else is looking for Jamie's services, Jamie absolutely has my buy-in into his products and his services, what he offers, his expertise. And so I think that it would be a huge benefit to whether you're the chief executive officer or you have somebody in charge of all of the operations of your facility, whether you're a COO or a director of clinics or whatever that looks like. Title aside, what matters is that we're taking care of patients and we're taking care of them efficiently. So, it was my pleasure to work with Jamie. I would highly recommend him to do work with any clinics or any process improvement aspect.